empowering, enlightening, and intelligent. Unprecedented times call for unprecedented conversation. Ladies and gentlemen, I present to you the LaRuelist Café. Let's talk about it.
Hello, hello, hello. I am so glad to be here with you tonight. I already did a little promo a little earlier to let you know that this is the unveiling of the first of 5 series commemorating Gay Pride Month. One of our guests on tonight has already told me that we don't have to celebrate Gay Pride all month long. We can actually spill it over into July. So we'll probably put a couple of these episodes into July, but they are going to be exciting episodes. Hi there, Connie Ellis and Karen Hilton. Thank you for stopping in. It's Sister Barbara Howard. She always shows up. Thank you. It's great seeing you. So we have some wonderful guests on here tonight to talk about a variety of things. But before I bring them on, I want to at least tell you what some of the issues are that we're going to be tackling. Because as you know, in June, that's when normally we have the Gay Pride, all of the parades, the festivals. We have a lot of shows, special programs. But because of COVID, Gay Pride has changed. It has been mostly virtual. So we decided, since it's going to be virtual, we're going to be virtual with it here on the LaRuelist Café. And I am so excited to be able to host this. A lot of folks will say, well, Janine, why are you hosting Gay Pride? Because I believe in Gay Pride. But the other thing is, we already talked about this 2 months ago. I'm gay. So if you didn't know, you know now. And I think most of you knew. And I just feel as though that we've got to make sure that we recognize all of our special groups. We are all special. And yes, we all matter. So some of the issues we are going to tackle on the show, and we're not going to tackle all of them tonight, but we're going to tackle how the differences and similarities of some of the old gay people who are 60 and 70, and I can say that because I'm old, and 80 and 90, they have their own stories. We're going to be bringing in some older gay people, and they're going to be sitting with gay people who are young. Did you know that some kids, as they're struggling with their identity, and they go to their family members and tell them, I think I'm gay. Did you know that some of the parents, some of the family members actually kick them out? We have someone who runs a homeless shelter for gay boys and girls. And we're going to bring that woman on in our next episode. And she's going to talk about what these young people are struggling with. We're also going to bring some gay couples on. Same-sex couples, 2 men, 2 women who have children. We're going to bring some transgender people on. It is going to be a magnificent series, and I don't want you to miss it. And if you can't watch it live, as most of you already know, we have it on YouTube, LaRuelist Café on YouTube, LaRuelist Café on Facebook Live, and you should learn something new. Tonight, our focus is going to be the 2 viruses. Yes, HIV and COVID-19. We're going to talk about these 2 viruses and how the politics of it, how they're treated differently, and how they're treated the same. The first person we're going to bring on, there she is, Lourdes Fernandez. How are you doing, Lourdes?
I'm great, and you?
Oh, I'm wonderful. Thank you. And
Glad
oh my goodness, don't you look wonderful.
Thank you. I'm glad to be here.
Well, you know what? And when you get done telling your story to those who are watching, they're going to know how glad you are to be here. Having survived HIV for more than 30 years, and now when you look at you're here in the COVID-19, and we're going to talk about what you do in the prisons. I can't wait to hear your story when you tell what you do on a daily basis. Thank you so very much.
You're welcome.
The next person we're going to bring on, we have a nurse here, and the nurse's name is Peter Oates. And there's something else I'll tell you about him a little later. I'm not going to tell you right now. I don't want to spoil all of it. But Peter, we're going to bring you on here so you can say hello to everyone. How you doing, Peter?
Hi, Janine. How are you?
I'm great. I'm great. How's it going?
Inviting me. Good.
Oh,
good.
are you kidding? And I have to tell you, thank you, Peter, for all you do on a daily basis. You know, you're part of that group where you are one of our heroes. And we thank you for that.
On behalf of all nurses, I appreciate that. Thank you.
Thank you. And you know what, Peter? Since you're up here, I might as well bring your husband on.
Oh.
Might as well, you know. Let's get your husband on. Yeah, because Peter's not only a nurse, he's also married to this guy. And I'm gonna tell you, Peter. You know, but see, Peter put Gary Paul in the basement. So, but Gary, you're looking good down there. You're looking good down there.
Thank you.
Gary,
okay.
Thank you so much for coming on, Gary. You know, I know that you have founded an amazing organization. We're going to talk about that organization a little later, of what you do every day. You have been on the journey for a very long time.
Forever.
Forever. You've seen a lot. You've seen a lot. So
yeah, I've been around since working with HIV/AIDS for like 30 years, and it's just been it's been a journey, yeah. But now with all the things that are happening now, it's such a different world now than it was. But the more things change, the more things stay the same.
The more they stay the same, and we're going to talk about that as well. And I know Peter just sees it every day. If he's not there, people are calling. And you two, as a couple, you are just doing amazing work up there in North Jersey. Thank you for coming on. Appreciate it. So now we have. Here's a guy, when he tells his story. How you doing, Ed?
I'm doing well, Janine. Thank you so much for inviting me to LaRuelist Café this evening.
My goodness. And we're going to, when we talk about Ed, now Ed's also a survivor of HIV. He has been positive for over 30 years and also has survived cancer. And oh my goodness, Ed, and then we're going to say, you didn't even get COVID-19. I am just so excited. So
fingers crossed. Fingers crossed.
But you're taking care of yourself. You're doing all the right things.
I'm doing what I need to do.
And we are just excited that you came on here. We have Melvin Ford and Adam Thompson, and I don't know how to say Christiana. Thank you, all of you, for signing on here today. Hey, Wesley, how you doing? Good seeing you. All right, thanks for coming on. We're going to bring you back in a second.
Okay.
All right. This guy, the guru. I haven't seen him in years. And Axel, everybody knows Axel anyway. Axel, how are you doing?
I'm blessed and highly favored, regardless of what you heard on the street. And I am very happy to be at Janine LaRuelist Café. It sounds like something really special out of New Orleans. So I'm actually pretty happy about that. I also want to say thank you to Peter. I know that it's been very difficult, and what he does and what everybody in his position is doing as nurse practitioners have been amazing. They are our heroes in this community, and I thank them very much. And I'm excited because I know everybody on this panel, so I feel that in this time of not being able to actually physically hug somebody, this at least gives me the opportunity to give virtual air hugs to everybody on the panel who I love and worked with for so many years. So thank you.
Absolutely. Thank you. And we'll talk about in a moment of what you do, but I just thank you for being here. Thank you so much. So, Lourdes, why don't we start with you? Tell me your story.
Well, I am a 60-year-old woman. I was diagnosed.
Now, someone has their, you might want to mute your phone. Well, I guess you can't mute your phone. Is that your?
No, it's not mine.
Somebody else. Okay, go ahead.
I'm a 60-year-old woman. I was diagnosed with HIV/AIDS in 1988, almost 32 years ago, August 27th, 1988. I got HIV from my husband. My husband passed away in 1990, August 10th, 1990. So 30 years, come 30 years. This August, I've lived through this, through the beginning of it, and uh, grateful and blessed to be here because I was told that I would live 2 years. And here I am talking to you 32 years later.
32.
Yes. And blessed. Blessed is the only word that could come out of my mouth when I tell you that I've been through a lot, ups and downs, but still here. With God's grace, it's nothing impossible.
And it's so beautiful because I just can't imagine how did you think you had, that you were infected with the virus? What made you even?
Well, my husband was sick. My husband was a school teacher, and he was on vacation during the summer vacation, and he got a temperature, and it got worse and worse. And we took him to the hospital, and they couldn't find nothing wrong with him. And they continued to check him. And I said, could you please give him an HIV test? Well, back then it was AIDS. There was no such thing. They didn't say HIV, they said AIDS.
You called it all AIDS, right?
Yes, they called it all AIDS. And I said, and I knew a little bit about the virus then. So I asked them, could they give him an AIDS test? And they told me he was almost dead. And they told me without his consent, they could not give him an HIV test, an AIDS test, even though I was his wife. And they gave me a very hard time. But eventually they did give him one, and he was diagnosed with AIDS. And they gave him 2 weeks to 3 weeks to live.
Wow.
And they asked me to get tested. And I went and I got tested. And I came up positive, and it was devastating. I was scared because of my family. I come from a large family. And maybe the bigger fear was all the people are going to be scared of me, because everybody was scared of anybody with AIDS at that time. People didn't want you to come to their house. People didn't want you to hug them and kiss them. I am a Hispanic woman, and the thing that we do is hug and kiss. But now all of a sudden, I won't be able to do all them things. And telling my mother was very difficult. She took it very hard. She still does. She doesn't look at this because she predominantly speaks Spanish, but she would have a heart attack if she knew I was here telling you my story.
Wow.
Because she's still not comfortable with it.
Wow.
And
32 years later.
Yes, 32 years later, she doesn't want me to tell anybody. She doesn't feel this public knowledge. It should be public knowledge. When I was younger, I kept it, to myself because of my mother, it was already a hard situation. So I applied by, she didn't want me to say anything. But after 32 years, and as blessed as I am, I just can't keep it to myself anymore.
Right.
And even before people know me, all the people on the panel know me, I've been talking about it and doing things for quite a while, for like 20 years. Prior to that.
Lourdes, tonight, with the folks who are viewing this program right now, you can't imagine who you're helping right now by telling your story. And I am so grateful that you're able to talk about it now.
Oh, yeah. And of course, in the beginning, the first 18 months, I couldn't say AIDS without crying. I couldn't say without crying. Every time, I thought that I had this thing that was going to kill me. I had a son, 5 years old, and all I could think is of my son dying, me dying, and my son not having anybody to take care of him. It was my biggest fear. It wasn't for me. It was for my son.
Right.
My son was a little boy. He didn't know no brothers or sisters. Father was already dead. Mother on her way to die at the age of 5. I have 5 sisters, beautiful sisters that would have took him in, but nobody
can do like mom, right?
That's right. Can nobody do.
And how old is that son now?
My son is 37 years old.
Thank you, Lord.
My son is 37 years old, so very blessed. Okay. Yes.
All right. Well, we're going to keep you up here for a second because I want you and Ed together. Because Ed, tell me your story. You are also HIV positive.
Yes, I am. Lourdes, thank you so much. I've seen you on the HPG for a long time, but I've never heard your story. It's very empowering. Thank you so much for sharing that with us. Yeah, so I found out on right around my 30th birthday, which was 34 years ago. I'm not going to tell you my age. You could do the math.
I
And
was an English teacher. Don't worry about it.
so I've been living with the virus for 34 years. And when I first tested positive, I remember walking out on West End Avenue in New York, and I had read a book by, or shortly thereafter, I read a book by a guy named Paul Monet, who wrote early on in the epidemic, and he referred to it as he felt like he was living on the moon. And that's how I identified with that, because nobody knew anything in 1986. The test had only been out a short period of time. No EZT, no drugs or anything like that. And I lived with two gay men who wound up passing before antiretroviral therapy came out. There was no support services. There was no Ryan White. There was nothing except for sitting on the auditorium floor at Xavier High School in New York, listening to Louise Hayes telling us that we could cure ourselves. And I had no coping skills, so I ran for a long, long time. My diagnosis went to an AIDS diagnosis about 1992, and I remember sitting in the restaurant with my sister. My other sister was having surgery, and the timer went off, and I took out my pills to take them, and she said, "What's that?" I said, "Vitamins." And that's when I disclosed my status to my sister. She was very loving and just wanted to make sure that I was okay. Her husband, on the other hand, wasn't so nice. So about 10 years ago, 12 years ago, I was receiving services out here in New Jersey, and Axel Morero and Dolores Doherty showed up, and they told me that I had a voice, and they proceeded to teach me how to use my voice. And shortly thereafter, I came down with cancer, and so I kind of fell off the face of the earth for a couple of years. But then I saw a movie called United in Anger, which is the history of ACT UP, and I realized how much work was still left to be done. So I reconnected with Hyacinth Foundation and started going to AIDS Watch on an annual basis. And I continue to use my voice. I'm still an active member of ACT UP New York. And I just, I found that it's important for people living with HIV to have a voice at the table. And that's what I try to do. I talk to my congresspeople on a weekly basis, my senators. You only get voicemail with senators, but at least the congresswoman responds. So I'm very happy to be here. I'm very pleased. I'm very blessed to be alive. I've had hepatitis C. I've had PCP numerous times. And cancer was HPV. So I've had my share of opportunist infections. The article that was written in Paz magazine the beginning of June was about resiliency. And much the same as Lourdes, I feel that we've become very resilient in our journey living with this virus. So, thanks for letting me share that.
My goodness, Ed, my goodness. And I can't even imagine when you talk about it, two people you were living with actually died from the virus, right?
Yes. One died went into the hospital on Friday and was dead by Tuesday. And the other one was my champion. He fought. And when I first started doing activism, I did it in memory of him because I couldn't be there for him. Because like Lourdes, they told me I'd be dead very shortly. So I was afraid that I was watching him die a horrible death, and I thought I was going to be next. I even bought a house in Arizona where I was going to go die. And then after antiretroviral therapy, I sold the house and moved to San Francisco. So.
Well, I had a family member who I cared for until his very last breath, who died from AIDS. Right. I had an uncle, and I had a brother-in-law. I had a stepson. Let me tell you something. I've watched this virus up close before all of the treatment, and I am just really, really happy to know that now, 30 years later, because when I heard 1988, that's the year that my family members found out they had the virus, and they were dead by the end of the year. Right. So I was watching 4 people in a row die, and I never thought back then that I would see someone in 2020. Well, I never thought I would live 2020, but because to me that's old. But I never thought that I would see someone in 2020 who is HIV positive in 1988, and you look so amazing, and you're 86. Able to talk about it publicly.
86.
86, even before 88.
Six months after the test came out.
God love you. Well, you have someone, Miriam Martinez, who's a very good friend of mine. Lourdes, she says, God bless you. You know, she's a kindred.
I know Miriam very well.
Oh, you know her. Oh, my goodness. Because I was going to say, you two look like your sisters. And then we have a wonderful freeholder up in Essex County, Patricia Siebold. She's on here, and she says she is really happy to be watching. And we're happy that she is watching. So I'm going to bring 3 of our practitioners on who actually deal with this all of the time, because they're listening to, you know, they're practitioners, they're advocates, they work in the vineyard all of the time. And I'm going to start, Peter, with you.
Okay.
So now you heard their stories. We're talking about back in the 80s. Now, when did you become a nurse?
I graduated in 1975 in England, in London. I did my nurse training in London. And I came to Newark, in fact, over 35 years ago. I was the nurse manager of the neurosurgical intensive care unit and the surgical trauma ICU at University Hospital in Newark. And I entered into HIV/AIDS care because I wanted to get away from the administration side of nursing. I needed to get back into the clinical care and practice. So I went back to get my nurse practitioner certification. I don't know what happened there. Okay. So I've been working with HIV for nearly 30 years now. Currently, I'm the Director of Healthcare Services for the FXB Center, which is a center within the Rutgers School of Nursing. And our team actually takes care of women, infants, children, youth, adolescents, and their families living with HIV. So we've been doing that for quite some time now in Newark.
What do the stats look like now? And I guess, Axel, if you could tell me a little bit about that, because from a public policy perspective, should people still be concerned about HIV?
People should be concerned about HIV because again, it's still a virus that you can get, again, if you practice unsafe sex or you engage in injection drug use or have sex with someone who's a current or a former injection drug user. The virus hasn't gone away. What has changed dramatically because of the work of people like Gary, Peter, the advocacy work of Lourdes Fernandez, of Dolores Dockery, I say her name, Truth to Power, and Ed.
Say her name, right? Say her name.
Say her name, Dolores Dockery.
Yes.
That what has changed is that we have forced public health institutions, the national and state governments to be able to create a system of care that literally was paid for 10 times over blood, sweat, and tears and in people's memories. We have built a system of care that in a historical context should be viewed as one of the fastest and greatest accomplishments of grassroots advocacy. And I'm talking about from A to Z. I'm talking about FDA approval, fast tracking of medications. I'm talking about the partnership between community hospitals and community-based organizations. I'm talking about community and grassroots organizations that have created the Ryan White system of care. If you take a look at it again historically, what was accomplished again by the blood, sweat, and tears of all of the advocates and people living with HIV and AIDS and allies like myself and others, that is remarkable. So the virus hasn't gone away. What has changed, because again of all the work that has been done over the years, is that the treatment of HIV has changed and the prevention of HIV has changed. I think that it's interesting that we're having this conversation because there are such great parallels between what happened with HIV in terms of the historical negligence and how HIV, STDs, and hepatitis C demonstrate that there is that there are disparities in healthcare between communities of color and other communities, and that same lesson and that same highlight is being shown today with COVID. So it's remarkable that Gary Paul started by saying, and when we were prior to getting online, he said, so much that we have learned, so much that have changed, and so much things have remained the same. And that's absolutely true when you draw the parallels between HIV and COVID. So yes, the virus has not gone away, that hasn't changed how you can get the virus, but what has changed because of the work that people have done is how you treat HIV and the prevention of HIV.
Thank you for that. Thank you for that. And we're going to talk a little bit more about that too. Look, I just want to give another shout out. I call her the godmother because, Kathy Ahern O'Brien has arrived and she's enjoying the show and we always enjoy her. So, I'm coming for you, Gary Paul.
Okay.
I'm coming for you because guess what? I have a full disclosure. And I'm going to tell all of you, especially those of you who are gay on the show, don't judge me. I'm going to tell you something that my son and I laugh about today, but it wasn't so funny a few years ago. So my son, when he was younger, because I've been married twice to men, never do that again. But I've been married. So look, Gary Paul, Peter, you can have it. It's so overrated. I'm sorry. So you married the men, and I'm done with it.
Okay.
But I remember when my son was younger, and he wanted to play the piano, and I'm a pianist myself. I played for a lot of churches, Pentecostal churches, AME. I just played for all the choirs. And I said, and in the black pulpit, Gary Paul, you know what they preach. Don't even get me started, okay? So they give you, people always in some of these churches, they thumb over out of the 66 books, they find, 5 or 6 lines, is bam, there you go, take that one. So my son wanted to learn how to play the piano, and I said, no, because every guy I have met in the church who plays the piano is gay. I am not going to let you take piano lessons. Now, I am telling you, my son was so frustrated with me. He's my only son. He's like, Mom, that's such a stereotype. You cannot take piano lessons. So now, hey, Louise, thank you for coming on. I hope you and your wife are doing great. Thank you so much. So all of a sudden, one day my son says to me, he was older, and he says, Mom, I want you to come on out. I want you to hear something. I always kept pianos in my house. He sat down at the piano and he begins to play. And I looked at him and I said, where'd you learn? He said, you wouldn't let me take piano lessons. God anointed my hands. Now let's fast forward. Fast forward. I remember the day that I said, you know what? I know I am not straight. And I've got to tell my kids that I'm gay. But I can't tell my son, who I wouldn't let take piano lessons, because I had this problem with his becoming gay, and he's about as straight as they come, he and his lovely wife and their kids. So I said to him, I called him one day, I said, can we go to, we went to this hotel, Marriott. I want to have a talk with you. And he said, okay. So we went to the Marriott, and we're sitting there and having fun, and then all of a sudden, I got a little uncomfortable, and I said, Sam, there's something I need to tell you, and I don't want you to be upset with me. And he said, okay. And I said, I don't know how to break this news to you. And he said, Mom, what is it? I said, well, you know what? I don't think I can tell you yet. And he said, other than you're gay, what? And I looked at him, I said, are you mad that you couldn't take piano lessons? So it is the running joke, because my son plays for these choirs and he doesn't know one note because his homophobic mom, who is gay, would not let him take piano lessons. So there you got it. And the reason, Gary, I had to wait for you to tell that story is because there are no black gay people, are there? How could you be founding something African Americans? What? Tell us about that.
Well, that was a great story. Thank you for sharing that. I came out to my mother at Woolworth's in Dallas, Texas, over a banana split. So, coming out instances are like, you never know, okay, when it hits you. But yeah, we some friends of mine and I sat around our kitchen table, Peter and like 8 or 9 friends of ours, and we thought, here we are dealing with HIV and AIDS at the time, and there's nothing really specific for gay Black men, and we knew, other agencies, were doing stuff, but nothing specific for gay Black men. And that's how we just kind of got ourselves together and said, let's do it. Let's make it happen. So we started working. We got our 501c3, and then Steve Saunders, may he rest in peace, let us know that if we got our stuff together, that he would maybe throw some funds our way, and he did. And 20 years later, we're still around. So I know a lot of people are doing the work that we're doing as well, but we're still involved in the community. We're grassroots. And then when we started our transgender outreach and programming, we were the first to get funding for that, and we were the first to have the state, actually give statistics for trans women. So we've come a long way, and we're still small, but we're still community based. And I think, when you talk about why you were put on this earth, I don't know why God put me on this earth, but maybe it was because of this, because, we've helped so many people, just along the way. And I'm just very happy that, we've been able to, help a lot of people over the last 20 years. I'm also very happy that my husband and I both work at HIV/AIDS now, because he wasn't at first, and now he had the opportunity working at University Hospital, or UMDNJ at the time. And so it's like you get 2 for the price of 1 now. We're both in it, and we wouldn't have it any other way. So thank you for having us on this together. So.
Well, you know what? Thank you for your story. And you do know we're going to have a whole session on married couples. And of course, because see, I remember when I met Peter, we were trying to get our little program together for tonight. And then I said, well, where's your husband? And he came in all garbed in the kitchen. He was cooking. And I remember, Axel, it was really a hoot, because we were toward the end of our meeting, but I think that Peter didn't think we were going quickly enough, and he was tapping that foot. It was time for Gary Paul to come eat, and we had to conclude our meeting for that.
I wanted to say to Gary that coming out in Texas at a Woolworths, that has a Netflix series written all over it. So, I think you should shop it around. I think I would watch it. I think what took it over the edge was Woolworths. I was like, okay. Now I'm in. It's interesting that you were talking about, the coming out in terms of the lessons learned, that you would hope and pray, especially in African American and Latino cultures. Both Lourdes and I are from Puerto Rico, that sometimes when you have to disclose to your parents, in my case, having to say that you're gay, sometimes their love is not enough to cross the bridge.
Yeah.
Right? So their fear of what will they say, their fear of what does this mean for our relationship and how I have to now live and breathe moving forward with you, that their love sometimes is not enough to cross that bridge.
Yeah.
And I think that, so when we deal with that, especially those programs like Gary and programs like at Hyacinth, that when we're working with especially with young people of color who are going through that process, understanding that trauma can literally be a marker for every interaction moving forward in their life, whether it's economics, or whether it's health, or whether it's housing, or whether it's interpersonal relationships with each other, trying to love another person of the same gender, that initial coming out and that process leaves a mark on you that literally changes and impacts every interaction that you have moving forward. And sometimes, again, it's you sometimes never get over that. What you learn to do is you learn to be able to live and thrive, but it's not that you never forget that your parents or your loved ones did not have enough, that their love was not enough to carry over you the bridge. So Yeah, that's
Just wasn't.
that's difficult.
And I'm so glad. I do want to give another shout out to Stephen Goldstein, who doesn't know at some point he will be coming on the show, and I'm glad that he did join. I had a lot of fun with Stephen when we were getting same-sex marriage together. He actually brought me in as a lobbyist, and that was a whole lot of fun. So thank you for that. I just have one last funny story, and then we'll get into another portion of the show. So I am a twin, and if I live long enough, 2 more weeks, my twin and I will be 70 years old. So, you know, my twin, macho guy, went to the military. Happy birthday. We're going to do something for my birthday. You know, one of the programs will be my birthday. And so my twin, you know, he never questioned. He kind of thought something was up, but he didn't want to go there. And I would never tell him because I didn't want my twin to lose faith in me because he's my hero. So I decided that we were going to a family event in Virginia. And we cannot lose Gary Paul, okay, on this one. So we were going to a family event in Virginia. And I said to my twin, why don't I ride down with you? I don't feel like driving. And he said, oh, okay. He says, well, I'm going to be smoking in the car. I said, oh, that's okay. I said, I just want to spend some time with you. So well, I didn't have the nerve to tell him on my way down. 5 hours. We talked about everything we could talk about. So on our way back, it was a horrible rainstorm. And I said to him, I said, Jimmy, I said, do you want to pull off somewhere? We can just sit and talk rather you keep driving. And he said, no, I'm good with driving. And I said, well, I have something I need to tell you. And he said, well, go ahead. I'm good. I can handle this. Because he's macho. Of course, he can drive in the rain. He didn't need to pull off. And I said, 20 Winnie, I'm gay. He said, you sure you don't want to stop for some ice cream or something? I said, did you hear what I just said? He said, I think I'm going to have a cigarette right now. I said, are you mad at me? And he just kind of said nothing for maybe 2 or 3 miles. And then he looked over at me. He said, you know, I've known this for a few years. I said, well, why didn't you tell me? He said, well, why didn't you tell me? I said, oh, you know what? Forget it. Just forget it. So we'll have some more guests on with funny coming out stories. But those stories are really, really funny because during those years, you couldn't talk about it. You know, it was just very, very difficult to talk about it. And so, Lourdes and Ed, here we are, COVID-19. People are coming, all the stars are coming on TV. I tested positive. You know, Chris Cuomo, he's down in his basement like Gary Paul, and he's trying to survive COVID-19. And it just goes on and on. And we're even talking about, I had some legislators in the program a couple of weeks ago where they talked about contact tracing. Can you imagine to talk about contact tracing with HIV? How do you two feel now that you're watching the politics, how this virus is being handled as opposed to HIV?
I personally think that it's because of the 2 different types of viruses. And in the beginning, they really didn't know. Because I recall someone in my office not wanting a person who had AIDS. They didn't even want him in the building. I even remember his name. And it was here in Trenton, New Jersey. It was a person that worked at the state. I used to work at the state at that time. And I remember they didn't even want to use his chair. They discriminated him so very badly back then. Now, I don't see that kind of discrimination against people who have COVID-19. It's like, it's so COVID-19 is it's better, I guess, if you want to say in another sense. People are dying, and you look at the numbers, you know, if you watch CNN, you know, all these numbers going up and up. And I kept comparing them to the HIV numbers. You know, like looking at my city and looking at the state numbers and the United States numbers and the people that have died, they're close to 100,000. And New Trenton, even Mercer County was close to 5,000. And then I look at the chart of the people who have died from AIDS, from HIV and AIDS. The number is much higher. But it was not. It surprises me that people never really put that much emphasis on HIV and AIDS, because I think that even though nobody ever said that you could get HIV from speaking, or from touching something, people still acted that way back then. They act like you could get HIV from touching somebody. I dare not tell somebody that I was HIV infected. And you want me to tell you something, Janine? Even today, people act like that.
Wow.
Because the education's still not there for everybody, but everybody knows about COVID-19.
And guess what? Nobody had to shut down, not just the state, the entire country for HIV.
Correct.
Nobody had to do that.
No, and still today, I go to places and I speak with people, and they have no idea that you cannot get HIV from sitting next to somebody, from touching somebody's hand, from kissing somebody. I'm amazed.
Right.
And COVID-19 closed the whole world.
There's much more stigma associated with HIV than there is.
Yes.
There is with COVID-19. And as far as contact tracing, part of the problem with contact tracing with HIV is the criminalization laws that we have for non-disclosure and all of that. So people are hesitant to divulge who they've had relations with when they seroconvert, because of the stigma that they could be brought up on charges if they haven't disclosed the status, particularly here in New Jersey. So those are some of the drawbacks that you have when you're talking about contact tracing with HIV, where with COVID-19, it's just everybody's susceptible. But when you're talking about HIV that is transmitted sexually as opposed to through contact, it's a totally different virus. And it's,
I'm sorry, because I don't want anyone who's listening. I want to be clear about this. If you look at HIV again, remember that early on that the infection rates among certain demographic groups allowed this country and policymakers to be able to say, "Oh, aha, it's them, it's not us," and therefore that dictated both public health policy going forward. With COVID, early on, you weren't able to do that because, again, the route of infection and the nature of the virus itself is different. Where you do see the similarities, though, is that it is clear beyond a shadow of a doubt that if you are poor, if you're African American, if you're Latino, if you're an immigrant and you're living in congested areas or in an urban area, you are more than likely, right, to suffer, exposure to COVID. And then whether or not that we have health conditions in our communities because of years and years of health disparities, which not only, again, is propagated by public health policies, both at the national and at the federal and state level, but that those health disparities make our community much more vulnerable to passing away, to ending up in the hospital, ending up in a ventilator, and passing on. So although that, again, there are similarities, there are big differences between the two in terms of what originally happened with HIV. Again, the demographic where it showed up originally allowed policymakers to say, "Oh, okay, there's a distinction. It's them, it's not us." COVID doesn't allow that to happen, but you are seeing that the health disparities, again, are highlighted in this COVID epidemic as well. So I don't want to lose sight of that. I also don't want to, because it's not apples to apples. It is apples to oranges.
Yeah.
So I just want to put that
down.
Absolutely.
I want to say something that happened this week. Someone said that somebody had COVID-19 and they didn't know me. And the person next to me is like, it's not like if they had AIDS.
Oh, gee. See?
And this just happened 2 days ago. 2 days ago.
And see, what you're doing right now, Lourdes, you're educating the public, those who are listening right now. And the other good thing about it is that this show will be on YouTube forever. Because the real deal with HIV, no one had to stand 6 feet from you. You know, you go into stores and everything's all marked up because they want you to social distance. We didn't have to social distance with people who are HIV positive. It's just that if you want to sleep with them, you had to practice safe sex.
Yeah, but you know what?
Nurse, what do you have to say? Oh, Gary, Paul, go ahead.
We can talk about the days in the olden days in the when HIV was ravishing everybody, and hospitals were like crazy. I mean, I remember I was a buddy when I first came to New York, and I was a buddy worked with GMHC, and I would go see my patient or the person I was assigned to, and he'd be in the hospital, and his food would be out, in the hallway. You know what I mean? So that stigma was like there, even in hospitals. People, working in hospitals would dress up in their PPE at the time, I mean, fully garbed, and just to put a tray in somebody's room. And oftentimes the tray would never even make it to the room. So, the stigma was devastating. But I think it's very funny now that I have, I see straight white folks on TV, Good Morning America, talking about, I walk down the street and people know I have COVID and they're staying away from me and things like that. So it's like, they're experiencing the stigma that, Ed probably and Lourdes, are still experiencing. So, we've like gone full circle, but this is what happens in this country when there's like diseases out there that people don't understand.
I remember trying to find a dentist early on, and it was almost impossible. And when you did find one, if you went in, there were 3 coats of plastic, there were 3 PPPs on, and if for some reason, if you moved to try to find a dentist in your new area, it was damn near impossible. You couldn't find physicians that were willing. Even in the 90s, when I went to a dentist, it was a father and son, and the father was retiring, but he wouldn't allow his son to work on me because he had a family. So the father, who wasn't afraid, decided that he would do the work on me.
Wow.
So the stigma, and that was in the 90s, which isn't that long ago, well after antiretroviral therapy. So
I think there's a huge difference so the stigma, let's say, for people living with HIV and AIDS, for my consumers, and for my friends, I think it's different because it's a sustained stigma.
Right.
Unlike COVID, that you get COVID, if you move on, you're celebrated as a survivor. That the HIV doesn't necessarily go away. You can be treated, but there is a sustained stigma that's not only attached to the virus itself. It's attached also to the demographic group that you represent. Right. That is different from COVID. That if you are, let's say, if you are a former or current injection drug user, if you are a person of color living in an urban area, if you are LGBT, if you are a woman of color, if you're a gay man, those demographics that you represent, right, have the added layer of stigma on top of it. So it's a sustained stigma, unlike COVID. COVID allows, and again, we don't know where this is going because who the hell knows where we end up. But so first and foremost, I think as a community, as a society, when shit hits the fan, you're always trying to look for the scapegoat. So, that's always going to be there. And you saw it with HIV in terms of, it's those people, it's these people because they do that. With COVID, you're starting to see, some of that stuff, and it's going to be region by region. So that's one. Two, that COVID allows you to be compassionate because you know that your mother can get COVID, right? Mm-hmm. So, and then if you think about the narrative, especially on the far end of it, is nursing homes, where you absolutely feel compassion because everyone says, I know that I can go through that, or someone in my family can go through that, or I'm currently living that through my mother and father. The HIV was different, and hepatitis C was different. Injection drug use is different because it allowed the general society to be able to say, it's them, not us. So therefore, I can be selective with my compassion. COVID is completely different in that sense. We'll see because, God forbid that we get a year from now and the vaccine is still not around, and COVID literally is entrenched in communities of color and in urban areas. I would love to see a test case to see whether or not federal funds would be, appropriated the same way, whether the same level of compassion would be shown to nursing homes in communities of color or in pockets of. I would love to see whether or not the compassion and the funds continue, because I think that would be interesting. I don't want to live it, because we're all in this together. But the lessons that were learned and the lessons that this community, this country has walked away from when it comes to HIV, injection drug use, or whether it's just general public health. There's some lessons that we learned and some lessons that we have completely walked away, and we're repeating those mistakes now with COVID. So it'd be interesting, to say the least. But the stigma's not the same, and the compassion level is not the same. It's not apples to apples. It's completely apples to oranges.
I agree.
Peter,
Unmute.
We can't hear
you
you.
lost your voice.
Unmute.
Oh,
I'm upstairs, Gary.
And no one's listening to me. Can you hear me?
we can now.
It's a good thing you're cute, honey.
Oh, shit.
Oh,
Now, I just want to give a shout out for nurses, because we're talking about differences and similarities with HIV and COVID. And from a nursing perspective, nurses were the ones to walk up to the front lines and take care and show care and compassion and willingness to touch and comfort patients, both with HIV and with COVID. In the HIV world, individuals were, and particularly the gay men, were ostracized and rejected by their families. And so they were separated with the disease when they were hospitalized because they had no family members coming. They had their chosen family members taking care of them. Mm-hmm. With COVID, it's the opposite. Families are not allowed to go in and see their patients. So again, nurses are stepping up to the plate to provide that care and comfort and touching when their own family members are not allowed to do that because of the restrictions of isolation. So there are some differences and some similarities. And I actually I'm a member of the Association of Nurses in Aid Care, and we were contacted by the VA in San Diego by a psychologist who found that nurses were really having a difficult time dealing with COVID. And so they reached out to the Association of Nurses in AIDS Care to provide some comfort and support to nurses, especially young nurses who had never dealt with anything like this before. And so we have a program called Walk With Me, and we're mentors to these young nurses who are really having a difficult time with the same things that nurses with HIV were going through. Their families didn't want them to go home. They were rejected by their families, the fear of taking the disease home to their families, very similar with HIV and COVID. And nurses were really ostracized within their family network and their friends' networks about working with HIV. And the same is happening with COVID as well. So there are very much similarities in the nursing field regarding that.
Peter, what keeps you up at night as a nurse? I mean, you've lived through treating patients, HIV. Back then we said HIV/AIDS. Now this thing called COVID-19. What keeps you up at night?
I worry about the opening up, actually, quite honestly. Mm-hmm. We're already seeing increases in those states that have opened up early. And that really worries me as a healthcare professional. HIV and COVID, we both have harm reduction strategies now, right? And we learned a lot from HIV, and we're applying it to COVID as well. So, in HIV, we had harm reduction. We have harm reduction in COVID too, wearing masks, self-isolation, self-distancing. But I worry that that's not taking place. And just as in HIV, some of the prevention messages are not getting across, I think the prevention message is not getting across related to COVID. And I really worry about that because it's so important. Just using simple techniques by using a mask and self-distancing will have a huge impact in the outcome of what's going to happen in this country.
And I share your concern. As someone, I'm in that group. I take blood pressure medication. I'm 70, all of those things. And I look at folks when they don't have a mask on. I drove up to get gas yesterday, and the guy put my window down. I thought I saw a mask. He didn't have a mask on. So he said, "Ma'am, may I help you? I'm trying to find my mask and put it on because I don't like to wear the mask in the car." And I'm like, how, disrespectful. So I didn't say anything to him, but when he came back to take my card and I had my gloves on, he had his mask on, and I just looked at him and said, "Thank you." But it's frightening how people are just irresponsible with this right now. And we're going to see it in the numbers. Tell you, let's start counting 3 weeks. I don't like saying it, but it's going to happen.
I think so.
May that not be the case. I feel like when you all of your life, you said, especially looking at my mother, her sisters, all the elders in my family that would, criticize people walking across the street for all sorts of stuff, Christian or non-Christian. I don't want to turn into that person, but I find myself, and actually Kathy, who's probably watching this, when we're on staff meetings, she's caught me basically yelling at people across my balcony, saying the same word you said, that it's being disrespectful, people not wearing masks, because this is a community effort. And again, I wish that at least 80% of that community effort and compassion was shown, and it can be shown now to both, to HIV, injection drug use, or hepatitis C, or STIs, and all of the health disparities in our communities, that if we truly would learn the lesson of that this is a community effort and apply it to all the health disparities, from the ground level up. I'm talking about universal access to healthcare all the way up to, to healthcare reform. And again, these lessons are being lived through, and we're just not learning from them. I think that we're just going to continue repeating the same mistakes, and the valuable lessons that we learned from HIV are just being wasted. And it's disheartening. It really is. I'm glad that all of us are on the panel, because you guys give me more energy to get out of my funk and say that, that this is not going to work, to say we got to continue fighting. But it's disheartening, especially from the leadership at the very, very top in this country. When you see that, it can be very disheartening. But
yeah.
And
I know, I've got to say this. I know he doesn't want, he won't let them display our flag.
Okay.
So I said, screw you. I have my flag here, and I have it right there next to the American flag.
I have mine here too.
And I see your shirt there, Ed. Yep. I said I didn't get any parades. I didn't get to go into New York. So I got all of this right here by myself, having my own little whatever.
Janine, don't start doing the flag waving, because June is also the month of Puerto Rican pride. Don't make me bring out my Puerto Rican flag too. Hold on.
No, I can't find it right now, but I have one of those too.
I got you though. I got you. Okay, what's up?
Wait, I love it.
Oh God!
Leave it up to Axel.
Oh my goodness! You know what?
You got to find joy.
There you go.
There you go.
This has been. I mean, I'm looking. We went over an hour because it's been so much fun. And I'm just happy to know all of you. You are now in my village. We are friends for life. Ed and Lourdes, you give me hope.
Mwah.
Oh my goodness, you give me hope. And I know that you've given a lot of people out there today hope. And Gary, Paul, Peter, Axel, keep doing what you're doing, because you are saving lives. You are dealing with people. We're going to have Elaine Helms on here. I can't wait to hear her story. The many young people whose parents have turned them out. And she's like, nope, not today. Yep. Not today. So this is going to be a magnificent series. Get more of your friends to watch us. We have quite a few watching tonight too. But thank you so much for coming on. And Ed, thank you.
Thank you for having us.
Very, very much.
It was so good to see my friends and colleagues here.
Yeah.
Wow.
I miss you.
Virtual air hug there, Axel.
I miss you guys. We don't have HPG meetings anymore, so I miss you guys.
Yeah.
Wow.
I thought about Axel, but yeah, we miss you.
Well, our issues committee still meets every month, right, Lourdes?
Yeah, we do Zoom.
We Zoom in every month.
Yeah.
Oh, we're learning how to Zoom.
We're learning.
The same.
Yeah.
Thank you very much, Ed. I'll be talking to you. Thank you very much. And Lourdes, thank you so very much. To my Axel,
Beso.
good luck to you. I know you're getting ready to travel. Prayers for you, okay? Prayers. To the wonderful couple.
You're up there.
I'm down there.
Okay, no, you have to look down. I have to look up. We're like the Brady Bunch.
Thank you so much, Janine.
Thank you, Janine.
When I'm ready to be around people again, I don't know when that might be. It might be for my 75th birthday.
Ooh.
But I'm going to call you up, and I want Peter to cook me a good meal.
I'll do that. You're on.
Thank you very much.
Thank you.
All right, thank you, Janine. Thank you so much.
Absolutely, Gary Paul. Love you. Love you.
Okay.
Thanks, folks, for signing in. Appreciate it.
Thank you.
Bye.
Bye-bye. All right, folks. Another LaRuelist Café. I hope you enjoyed this half as much as I did, because as you can tell, I had fun tonight. Thank you.